communities really does make you think of health in a very different way. I think some of us kind of going into the class kind of had this, I don't want to say narrow view, but you have this very biomedical perspective of what is health, and it really, the class really gives you a much broader view of kind of what is a healthy community.
I say to them, I want you to come into the class with a lot of questions, and my hope for you is that you leave the class with more different and better questions.
The classroom component was really incredible. I was reading things about health insurance that I mean, having been like a freshman and sophomore in college, hadn't really pursued. But then coupled with the kind of real world experiential learning, it really let us kind of go deep in.
The course itself could have been a very unmotivating course for students because you learn all about the current problems in the healthcare system and where work needs to be done. But the instructor, Carey-Best, made the course extremely motivating by pairing up students with internships with doctors at the Community Health Center in Middletown, which was a defining experience for me, being able to work one-on-one with a doctor and see one-on-one how these things we're learning about in class that could have been depressing are being fixed, which was extremely motivating.
When they read things and they feel discouraged, and then they go to the Community Health Center and they meet their preceptor to work on their project, they have to remember this person's been doing this for 10, 15, 20, 30 years, and they're still full of fire.
In the 6 years, I think it is now, that we've been partnering with Wesleyan on the Service Learning Partnership, we've utilized the Wesleyan student research teams often as the first phase of a project. The people who do the groundwork of the literature review, get started with the early data review and extraction, interview patients or staff using some formal survey tools. This allows us to take advantage not just of the great energy and vitality and intellect and exuberance that Wesleyan students always bring, but it allows us to focus those talents on very specific research questions that we need answered at the health center.
And that included things like helping people with tobacco cessation. It's included treating opioid addiction in a primary care setting. It includes what's called upstream behavioral health intervention in utilizing school-based health centers.
The students have worked on that, looking at, well, what's the impact in a city like the city of Meriden, Connecticut, where we now have a behavioralist in every single school in the city? What's the impact on visits to the emergency room for primarily psychiatric diagnosis? Obviously always a crisis in children. Well, we've been able to quantify that the number of ER visits for primarily psychiatric reasons has been dropping each year since we implemented the program across all the schools.
The work that they do 3 to 4 hours a week for their and with their preceptor on a particular project, it matters in somebody else's life, and I think that's very important for them.
It gives you firsthand experience on what a really progressive clinic the community health center is doing to try to equalize health for all and make healthcare accessible, and that's very valuable. But it will also maybe inform the kind of professional that you want to become.
It definitely made me question wanting to be a doctor. It completely complicates what I had thought was like a totally, like, hands down, being a doctor is good. Like, if there's there's problems with being a businessman, like there's problems with being a lawyer, but like being a doctor means helping people. And I'm sure that like on a personal level, like most doctors want to help people, but it added a whole level just to thinking about like medicine as an institution that I had like never considered.
It doesn't make things easier. It doesn't make them feel that going into medicine is going to be fun. Although I think it may help them to see just how terribly important it may be that a person with their understanding moves into a leadership position in healthcare and becomes an advocate.
I am getting my master's in public health at Columbia University. I'm in the Department of Population and Family Health with a concentration in reproductive health.
Right now I'm in the process of applying to medical school, and I'm working at MIT as a lab manager and as a research assistant.
I'm not pursuing a medical career. I'm actually planning to go into indigent defense as a public defender. But I'm really going to work to integrate the lessons that I learned in health of communities. So as a public defender, I'm looking forward to working to develop holistic programs where, you have someone who comes in charged with robbery, you can defend them in that case, and hopefully you can keep them from going to jail, which in itself is an enormous step. But there's so much more to be done. That individual, if you don't take steps to address other issues or circumstances that may be afflicting them, it's very likely you'll see that person again.
They've become members of Community Health Corps, which is affiliated with AmeriCorps. They've gone to the Peace Corps. They've worked for volunteers in Asia. We have a person now who's on a Watson Fellowship and whose project on the Watson is studying community health workers.